Can I tell you all about a day in my life as a psychiatric nurse practitioner that owns my own private practice? If you don't know me, my name is Alysha. I'm a psychiatric nurse practitioner and I own my own private practice, and I teach other psych NPs how to start private practices to find freedom and balance in their lives. Okay, what did we do today? I'm going to walk you through it. So I started off with sleeping in. I usually start my clinical days around 10 or 11 a.m. And that is because most patients aren't wanting to get up super early. Every once in a while, I'll have a patient that wants to see me at like 8 or 7:30 before work. But for the most part, I'm seeing patients starting at 10 or 11 a.m. So I slept in a little bit. I happened to not have patients starting until 12. This was a clinical day for me. I only see patients 2 days a week, and the rest of the week, I obviously run my mentorship program for other NPs wanting to start private practices. You can read more about that down in the caption if you like. So today I started my day around noon, though I usually see a couple of patients before noon, but just didn't have patients booked super early. And then I had a lunch with a pharmaceutical rep. And so the reason that I meet with pharma reps is because I think it's really important to understand the new drugs that are out into the market. Doesn't mean I'm going to prescribe them. If they're good and they're reasonable and the patient is a good candidate, sure. But it's more for my education because the medications that are new to the market now, when I'm practicing in 10 or 20 years, those might be the, normal meds that are used on a day-to-day basis. So I met with one of them, just got some info, got like the package inserts for the new medication. I also had my Psych NP students with me, which I usually always have 2 to 3 Psych NP students rotating with me. I don't want to take too many. I don't want to overwhelm patients, but I usually have a couple. And so we talk through what the new medication is, what might be some clinical reasoning for using it, etc. Then we started right away on patient care. Today, I happen to have mostly medication management patients, though sometimes I do have longer therapy visits. So today I had about 5 clients where I was doing medication management with them. And then I finished around 6 o'clock. So between 1 and 6, I saw about 5 patients. I like to give myself breaks for charting, breathing, etc. I don't like to see patients back to back. I don't want to rush patients. If someone wants to go a little bit over, that's okay. I do run a cash-based practice, so I don't feel like I have to pump out volume. I feel like I can take time because I set my rates appropriately for having that extra space and time for patients that need it. Another thing that I did with my NP students today was I spent an hour or so answering their questions and going through just things that came up through their week that they wanted to go over. One of them had a test coming up on bipolar disorder, so we talked through when, why, how you would initiate lithium on a patient. So we talked through that one. Another thing I did today was answer all of my patient messages. There's usually only a few per day. Like I said, I only see patients 1 to 2 days a week, so I keep my, clinical load pretty small. I have about 100 patients right now. And so I only have maybe 2 to 5 messages per day. So I usually answer those, reschedule patients if they need them. I do my own scheduling, even though I have an assistant. I find that to be nice because then I have control over my schedule. And so now I'm going to go home with my husband. We're going to make dinner together. I'm going to meditate and be in for the night. And so that's a quick day in my life as a Psych NP that owns my own private practice. And if you have questions for me about how my full week goes, again, like I said, I have 2 clinical days and the rest of the days I do mentorship and teaching. So please comment below if you have more questions about my schedule or questions about how to start a practice like this or questions about what my entire week looks like. Whatever you want to know, I'm here to educate and help. All right, guys, I will see you guys in the next video.